Welcome back to Face It with Dr. G. I'm Dr. G, and I'm so happy to have you here today with me to listen to a really fun, interesting, very relevant topic. I wanted to talk about our GLP-1 agonists and aging, and how that's impacting not only the aging process, but how we advise our patients and what treatments we do and what products we choose, because it's really changing, especially and specifically in my practice. And I want to speak only from my experience, and I'm sure all of you maybe have different experiences, but this hopefully resonates with you and helps you and gives you some tools to talk to your patients and address them and help them understand the process. So what I've recently encountered is the majority of my patients will come in and say, I want 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 things done to my face, but I'm on this weight loss journey. And that's always kind of a side note, or maybe it's a main point of the conversation. But it's interesting because that immediately makes me think, okay, what does this mean for them? Does this mean they want to do it, but they're not ready? Do they want to do it and they don't care that they're losing weight? But the overarching theme is that their weight loss is affecting their physical appearance. And that is so true. And we know that. And we know with all of these weight loss drugs that are out on the market that not only is facial aging accelerated, but it changes the way we're aging. And I've seen that it not only affects how I restructure and revolumize the face, but it also affects how we inject neurotoxins. As we lose our fat pads, which happens more quickly with weight loss medications like semaglutide, which we have in our practice, it affects how I approach them. So we also lose bone, as we all know, as we age, and so you want to start deep and you want to give that structure to the bone with something like Radiesse or calcium hydroxylapatite. And then you also, on patients that have lost a lot of weight, want to replenish volume in their fat pads. And historically, we've thought that it's not great to revolumize or replenish the superficial fat pads. But I've changed my approach, and I like to revolumize every layer in the appropriate way, avoiding that middle layer, or the SMAS, the superficial musculoaponeurotic system. There are studies that show that with product injected into this layer, you have a higher likelihood of migration and complications, and also a change in the dynamic facial movement, which changes the smile and the eyes. So we want to avoid that layer. And I see this all the time on ultrasound in our practice when patients come in and they feel overfilled and they feel as though their face just looks different. Usually it's the smile they notice first, and they say, what's going on? And after ultrasound, we see there's product that's placed in the mask. So we want to get rid of that. So in general, I like to start deep. I like to help with that bone replenishment and thickening that support, that deep support, and then looking at those fat pads. And when I've seen patients that are on these weight loss medications and they come in, it's typically, how do I describe this? It's a shift in superficial skin in those superficial fat pads that appears fluctuant of sorts. It's really unsupported. Depending on the thickness and the health of that patient's skin, you see accelerated jowling, accelerated formation of nasolabial folds, and accelerated just overall descent, even affecting the submental region and the neck. And that's because we're really losing that structure in the posterolateral aspect of the face, not only the bone, but also those fat pads, superficial and deep fat pads. So my approach has changed. I really, not hugely, but I really structure and support posterolaterally first using something like a collagen stimulator. So yes, they've lost those fatty tissues, but we're going to rebuild collagen and help with that support that's gradual, that's not going to give them an over puffy appearance over time. So starting with something like Sculptra, Radiesse, usually deep down on bone, again, to give that support. And then seeing that patient over the course of 6 months to a year to give that gentle, natural support. Then we can use things like hyaluronic acid fillers to help with quote unquote icing on the top. And this is where I'm now using these hyaluronic acid based fillers that are pre-hydrated to help with also with fine lines and wrinkles and hydration of the skin in conjunction with neuromodulators. So in patients that are on weight loss medications, because they're losing this volume at an accelerated rate, you'll see that their lines are seemingly worse. And this is because the lack of support that's essentially supporting the skin, and the muscle is really active, and you're seeing skin essentially more movement of the skin, and it appears more like an accordion. So many more lines can form, and when you actually give that support and hydration to the skin, those can be minimized as well. So my dosing, I think, for patients has gone up, and that's if you're only addressing the muscle, you're probably going to use a higher dose in patients on semaglutide. But if you actually revolumize them and give them the support they need and use that in conjunction with neuromodulators, that's the best approach. So in general, this is short and sweet. I think that you need to analyze your patients very critically when they're on these medications, figure out what exactly the issue is, but addressing them and approaching them using both modalities of volume replacement, collagen stimulation, and neuromodulators, that helps give the best result. Patients are going to feel better overall, so they're going to be happy, hopefully, regardless. But it is an interesting dynamic when you're dealing with the accelerated aging, the accelerated loss of volume, and overall youthfulness when it comes to weight management and health, but keeping up with their face, their facial anatomy, and their aesthetic, idea and their aesthetic goals is just a little bit different. So I'm still learning. This is my approach so far. I'm sure you all have ideas about this topic as well. Let me know what you think. Can't wait till next time.